Dr. Chaudhry, I just wanted to get in touch with you today because we've had a lot of conversations on the phone since you got the PulStar. You've always had these fantastic stories about patient interactions that you've had with the PulStar and how the PulStar has affected you and your practice. And I just wanted to see if we could get some of that information from you, just so that I've got it in the record, you might say, and I won't forget these things in the future. But just wanted to kind of interview you about the time you've had with the Polestar. You've had it since about 2017, so 7 going on 8 years, which is fantastic. But just wanted to kind of get your thoughts and see what you think about the Polestar in general.
Absolutely. Well, like you said, I've had it for about 8 years now. I started about 28 years ago total. So I was in practice for about 20 years before I got the Polestar. Just to give you a little history, when I graduated, I was doing upper cervical work and using a thermal scanner. So I was pretty much focused on Atlas and Axis at the top. I was trying to find the one spot that could fix everything and make it really good. I learned very quickly that's not how the body works, that you need to keep things tuned up and keep it going as we go. So I realized I want to get good equipment to make everything much easier. I quickly got one of my favorite tools was my drop table. And first I thought, why do you need a drop if you know how to adjust? Well, I learned you can adjust, I feel click, and you will usually feel, ow, oh, hey, what was that? So the drop table distracts you and makes the adjustment that much easier based on the simple premise of force is mass times acceleration. So you can use more mass or use more acceleration. That you accelerate, the table drops, you drop, I drop, bang, it works. And I used that for 20 years, which I loved. But ultimately, I was working harder and harder, seeing more patients. I got up to 65, 70 hours a week. And ultimately, I ended up with high blood sugar, high blood pressure, and had a stroke in 2017, which is what freaked me out pretty good because I thought, oh my gosh, am I done? I love adjusting and I want to keep being able to do what I do, well, till I'm at least 80 something. So I went looking to see what I could find because I'm always watching for the best technology and the newest high-tech toys. I, of course, in school was trained with an activator, which was good. I had a 1, a 2, I had a 4, and I was looking forward to the 5 with the electric, but it was still just a 1 click and done. It never really answered. It didn't do enough. I didn't know what I wanted because I hadn't seen it yet, but I knew I wanted more than that. I went looking to find some other tools, and I did find some. I found a couple of tools out there that are a multiple impulse, but it was very rudimentary. It's a power hammer, basically, doing the job.
I like that analogy.
And it did work well, but yeah, it still didn't elevate me to a better, higher status of what I wanted, because I wanted to be able to adjust, and have you say, what, really? That easy? Oh my gosh, this is great. Because I go on the premise of keeping people as good as they can be so that they only have to come in as little as needed. I try to get them in at the first time. They're going to come back in about a week. We adjust, get them out 2 weeks. We try and go 4 weeks. We try and go 8 weeks. I try and push them out to about 4 months. Unless they need sooner, they can call me and come back in sooner, of course. If they're a mess, don't get me wrong. If they've had an accident, a fall, an injury or something, that's a different story. It takes a little more. But if you're doing really, really well, just like the dentist has you come in every 6 months to get your teeth cleaned. Some people need every 4 months to get their teeth cleaned. Chiropractors don't talk about routine maintenance much that way. So nobody seems to have that idea. So chiropractic maintenance care, I like to get them as good as they can be and do that. And I can do it, but I worked myself into almost into an early grave. I stopped before I had any trouble. When I found the PulStar on, I believe it was Chiropractic Economics when I first saw it, and I saw the name. I started looking it up online and doing some research and searching for what is this PulStar. I found it. I found a few other tools that didn't look as good. The quality clearly wasn't there. Not to bash on them. But when I started talking with you, I was very impressed with the professionalism. And like I said, I asked you, is there anyone around me so I can check out the PulStar and try it? And there was a guy right in the city next to me, but he unfortunately had a stroke and passed away. There wasn't anybody else really close in my area. So I asked, is there anyone in New Hampshire? Tammy's from New Hampshire, so we always go out there every year to see her brother. She's my office manager. So you said, yeah, you got this great old chiropractor out there in New Hampshire. I gave him a call. He was wonderful. Come on out, love it. So we made a run for it. We went to Disney World first in Florida on the way to New Hampshire, and ran around Disney World for the weekend to have some fun. Tammy managed to twist her ankle and fall, sprained her ankle, and it swelled up about the size of a softball. I tried to adjust it right away, but it didn't go down. It was too late. It was swollen up pretty big.
Mm.
So the thing with Tammy is every time I adjust her, she takes 2 days to respond, which is frustrating because I adjust her. How you doing? I don't know. 2 days later, oh, okay, yeah, I'm better. Okay, good. So I always know it takes 2 days with her. So I did what I could, but I figured we're traveling. We'll have to give it time to heal. So we got to New Hampshire and got out and met this chiropractor. He was 80 years old, turning 81. And he, remarkably, his office looked very much like mine. He had the PulStar. He showed me how to use it, and he did it on me. And I tried it. Wow, this feels great. So I tried it on him. I said, Tammy, let me use it on you. She says, we got to go. You're running out of time. We got to go see my brother. I said, I know. Let's go. Let me just do your neck, and I'll ask you in 2 days how you're doing, and we'll see what's going on. So I adjusted her neck. The only thing that showed up on the PulStar was 2 red spots at C5 and C6. So I adjusted C5, C6. They went in beautifully, did a little post scan, green, love it. Okay, didn't really know what to expect. And we headed out. Within half an hour, as we were leaving, driving to her brother's place, she says, oh my gosh, my ankle feels fantastic. And I said, what do you mean your ankle feels fantastic? I didn't even do your ankle. I did your neck. She said, I don't know. But so when we got there, I checked her ankle out, and that swelling just went away in 30 minutes, which I had never seen with her before, that fast a result. That was incredible to me. And that also was the first time I realized, which I had never known in 20 years of practice, that C5 and 6 relate to the ankles. In the past 8 years, I've been talking with other PulStar doctors and saying, hey, do you ever see any connection with the neck and the ankles? And a few of the doctors, oh, yeah, I have. The lower neck seems to go with the ankles. And I'm starting to see connections that I never knew before I had a PulStar, which was quite interesting to me.
Yeah.
Because that was weird. Anyway, at that point when I saw that, I thought, I've got to get this thing. This is incredible. I have not seen results this fast, this amazing. I thought maybe I'm just, I don't know, maybe I'm crazy. Maybe I've had too much to drink. Something was off. But it was pretty incredible. But when I got back, I ordered a PulStar from you and got it. I don't know if I've ever told you how impressed I've been with the quality of the PulStar. Just feeling it, holding it. The materials are amazing. They're easy to use. They're quality products. They're not cheap or plastic. It's not just like pop, pop, pop. It's a very good quality machine, which is what I love. It's simple, and simplicity is the best. It's easy to use. It doesn't take a lot of there's not a high learning curve to figure out how to use it. I mean, you have to know how to hold it, how to do it, how to make it look seamless and easy, but it makes me think a step ahead of what I normally would. Normally, I'm trying to find the subluxation, figure out what's going on, and try and fix it. Now I'm thinking, okay, I'm fixing it. What am I going to do next? And if there's a problem, how do I go back and make this better? So if I'm adjusting with the osseous function, the bone to adjust the vertebrae, let's say, and it doesn't really want to go, it's kind of better. I'm watching for that because it measures with every push how tight you are. It'll do the and stop. And if I'm trying to get it to stop sooner, so I'll keep doing it and doing it until it's and stops. And if it stops earlier, like if it stops at 80, wonderful. If I do it again, it'll stop at like 50. If I do it again, it'll stop at 30. It's like, hey, stupid, stop. So I always watch for it to stop, and then I know we're good. If it doesn't want to let go and release, then I know there's something going on. So I can look at the bar graph and see the muscles around it are to the right, which is really tense, that they're tight. If there's a bunch of bars, like 4 or 5 of them in a row, above and below the vertebra, which happens, the muscles above and below are splinting and holding everything together, then I'll do the different functions. Like the first one I'll go to is point, for trigger point. And that one revs up and down like a motorcycle is what I tell patients. It'll zoom up and zoom back down. And that will talk to that nerve, that Golgi tendon complex, that tells the muscle how tight to be. So it'll reset the resting tension and release the muscle, loosen it up so that I can go back to osseous and finish the adjustment, and it'll done. Okay, and I'll move on to the next one. And usually when I get through, I think it's all 5 typically that I'm doing the worst to the least. You can do whatever order you want, which is what's nice. There's that freedom to set it up. You can go from the bottom up, the top down. You can go from the worst to the best to the worst, or whatever you want to do. You can set those settings and preferences in the PulStar.
And
which
that's
is,
the list of the vertebra to adjust.
yes, that's how you want to do it in whatever order you want to do. And of course, you can add your own things after the fact, where
Right.
if I'm adjusting and I get rid of those 5 bars that are there and 4 more new ones show up somewhere else, I'm like, oh, okay, that's round 2. We've got the first layer off. That means you've been gone too long, or you've adapted to it and you've been adapting and adapting and adapting. So I'm peeling away those layers to get through to the root of the matter, which is what's so amazing, because when I adjust manually, I get through and there's those other layers, but I can't, I'm doing so much physical force that I can't continue and get and push the patient further, because there's only so much someone can tolerate. I don't want to beat them up and hurt them. So I push it and then I got to stop and then I got to come back. With the PulStar, I get further with every visit. And the longer that I use the PulStar, the more often that I use it, the better they seem to get with it. The more reactive to the PulStar people seem to get, which is what's nice. The easier they get to adjust, and the better. It's a fine tuning, basically.
Okay.
It's a precision instrument that just really gets it even better. So my goal to get them out is wonderful. So when they come in, I use my PulStar right away after the physical. We're going to check the spine, go down, and I'm telling them I'm measuring every single vertebra. The PulStar is going to measure the tension in the spine, put it together in a nice little bar graph, and we'll show you what's going on. I explain the bar graph. The small bars are the vertebrae, the larger ones are muscles. If the little ones get bigger, 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 they will turn red. And where they are red is where you are subluxated. That's what we need to adjust. And the bigger ones, if they get bigger, 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 and go past the standard line of what's usual, the muscle's getting tighter and tighter and tighter, and it will turn orange. So it's pretty obvious, which is what's wonderful, because you get that visual analysis with the bar graph of red and yellow is, oh geez, don't like that. And green is, oh yay, we want green. Everybody wants to be green. Not that everybody goes from bad to perfect every single adjustment. You can get rid of 7, 8 bars and still have a couple red, and that's okay. I leave those because that's a wonderful improvement over where they were when they got there. And then I'll get the rest next time. As you go, I do expect it to get better and better and better, because the PulStar, if it really works, should keep improving and getting better and better and better. And I had very, very high expectations when I got this from you. You didn't know, but I was expecting a lot. And I got to say, it lived up in every way. Everyone has improved to the point where I've even had people come in, I scan them with the PulStar, and they're all green. There's nothing there. And I'm like, wow, okay, this looks amazing. So then I will start trying to test it. Well, of course, years ago, I was doing it by hand. Let's get you on the table and make sure. And I still couldn't find anything else with any other test: motion palpation, static palpation. I'm doing muscle testing. I'm doing range of motion, active and passive. I'm moving them all over, and everything's looking pretty darn good. So I trust that the PulStar, when it tells me they're doing well, I know they're doing well. The other impressive
do you use those changes to kind of guide your care with the patient as well?
Oh, absolutely, absolutely. When I show them the bar graph, and if they've improved, if they're going to come back in, if they're brand new, they're going to come back in 1 week, and we'll see some improvement. So that's where we get the 3 graphs. You'll have last visit, today's visit, pre and post. So I can compare today's pre with the last time's pre, and then with you uncheck the check, you can actually compare the post and post as well. So I can say, oh look, you had 8, now you have 6. You're improving. This is good. So instead of 1 week, let's go 2. Instead of 2 weeks, let's go 4. Instead of 4 weeks, let's go 8. I'm going to double, double, double. Unless you need me, call me sooner. We'll get you in. But I'm trying to push people out because they're doing better. Now, I can also look at the post scans and say, look, today you went totally green, and last time you still had 2 or 3 reds. So and I can also look at under the review, it shows you all the things you've adjusted. And I can see a paragraph this big of what we had to do last time. And this time we only had to do 3 or 4 things. I say, look at that. It took less work. We got more muscle release, and you're better, faster, which is wonderful. So it supports me in everything that I'm saying and telling people. I love the, the myofascial function as well, because that one, I call it the super fast. And so when we turn that on, you can get into the muscles and and it just melts them away. You feel people just relax. Their shoulders drop down from their ears. They sit there and go, oh God, I can feel that. That is nice. People love the myofascial, which is what you told me when I got it. I asked you, what's myofascial? You said, well, it's muscle. I said, yeah, I know Latin. I know it's muscle. You said, well, be careful. It feels really good, and everybody's going to want you to do just that. And I see what you mean. As soon as I tried it, I was like, oh wow, this is nice. But I still stick true. I'm a chiropractor, so I want to adjust. So the myofascial, while nice, I'm using it as an adjunct with the osseous first. Get the vertebra aligned, then relax the muscles so that everything stays in place better, rather than just trying to loosen the muscles or the bones. The adjustments are the most important thing. But what I like is the freedom to pick and choose between osseous adjusting, myofascial for muscle super fast, or point for trigger points to rev up and down and turn muscles off, which is also great for various muscle groups. If you have sciatica, you can put that right in the middle of the butt and get the piriformis to shut off with that point function, which is wonderful. Frozen shoulder, if you can't move, you get that shoulder adhesive capsulitis, you do that point function up there, and it just loosens the shoulder up beautifully. Then go into osseous to adjust to get things to stabilize and hold, and they get over all that issue ridiculously fast. The
Nice.
specific function is one I don't use often. I know that when you can control the rate, the speed of what you're doing. I haven't quite integrated that into what I'm doing yet, and I'm not sure. I have questions for you on that, but um, I honestly, I've done everything pretty much with osseous and that little double probe, because I'm just going down the spine with that probe. I do use, I gotta say, I do use the accessories a lot. I got all of them. The Walton tip is one of my favorites because it has, well, I can't believe some people like that little sharp pointy tip that
Right.
digs in, but the rounded edge or a sharp flat edge or whatever you need, you can get behind the scapula and dig out the serratus anterior. It's wonderful at muscle work. There's a big single cushion one that's awesome for releasing muscles on point. There's a little ball that's a little harder. There's the round one that you can kind of slide and move to strip muscles out, almost like a cross fiber massage with the PulStar, which is just, I thought myofascial was heavenly, but you put that on there and start working. People, they want me to do like a 2-hour massage with the PulStar. I'm like, I don't work that. I don't want to, but it works really, really well. So to anybody who's thinking about it, I have to say, get the accessories. They are so worth it. I haven't found one accessory that I've looked at and said, why would I use that, and not used it. I've used every one of them in one situation or another. They've been very handy.
Nice. Especially
So,
good for the extremities and
oh
like you
gosh,
said, the
yes,
myofascial mode.
exactly. Ankles, knees, hips, shoulders, elbows, wrists, hands, even like I said, ganglion cysts. If someone gets a ganglion cyst on their wrist, we would smash it with a book. And it used to be called a Bible bump because you'd smash it with the Bible because it was the biggest book there is. I had a
Something
woman who
heavy.
came in and said, you have a ganglion cyst. We need to hit it with a book. She went, nope, nope, nope. I said, oh, okay. She went to the medical doctor and said, well, what's going on here? He said, well, that's a ganglion cyst. And she said, what do we do? He said, well, honestly, you hit it with a book. And she said, well, that's what the crazy chiropractor said. And he said, well, go back to him. He does it more than I do. He'll probably do it better than I will. So she came back and said, here, go ahead. I said, okay. So I used to do it that way, but I've been using the PulStar, and I use the PulStar now to get rid of that ganglion cyst. And it's not that the book hurt, but it's so much quicker and easier. Just boom, 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 done. Ganglion cyst pops, absorbs, goes away, and they're feeling great and didn't even hurt.
Nice.
Quite amazing
Nice.
that way. I've also used the PulStar for TMJ, which I was a little worried about at first because we're talking about a pretty sensitive area, but adjusting the jaw directly, I mean, it just loosens things up, puts them back in place without overdoing. I can control the force. And so the more I'm adept I'm getting with managing the force settings, I can pick whatever I need, which is also amazing peace of mind for me. Because if I have patients who have osteoporosis, I can turn that down to 5, 10, depending on what I want to be. I have the default settings, but you can alter the force to be what you need. I have some big burly guys, I can turn it up to 20, 25, and okay, we'll get in there and get it to move. You also have that bar graph that shows you about how hard to hold it to get the maximum effect. So as long as I keep it within that green bar, it's great. And I show patients here, look, you'll see if I'm down here in yellow, I'm not pushing hard enough. And if I go up too hard, it'll turn orange and it'll slow down. And they see that, and like, see, it keeps the force right where it should be. So I don't ever have to worry about over adjusting with it. I have a patient with ankylosing spondylitis, and his spine is fusing. He has very limited range of motion. I mean, 10 degrees looking up or down, which is his whole life. If he can't move that 10 degrees, he can't see anything. He's pretty much hunched forward and downward, and that's kind of how he goes. Trying to lay him flat on my table, It doesn't work. I have to have his head up about 45 degrees just to have him laying on the table. So adjusting manually is very difficult, and he has AS, so I can't get in there because I could do damage to the joints, and you don't want to do that. So the PulStar, I can set the force where I need it to be and adjust, and it's very specific, and it doesn't cause a problem. I have patients with screws, metal implants, with Harrington rods in their spine. They're, oh, I have rods. I say, no, the PulStar is not going to hurt you. It's not a watch. And I start doing it. Then, oh my gosh, that feels great. I said, yeah, it does not hurt. I'm not going to twist you and pull anything. It's going to put it in with the right amount of force in the right place. It's not going to, beat you up. And once we start, they see that. Some people, I have one woman who has some screws in her ankle. She's had her ankle fused, and she was very nervous. Oh no. I said, no, I'm not going to move you here. And I did the PulStar, and she, oh my gosh, that is so much better. Now I go to grab her ankle, and she goes, oh, wait, no, get the little clicker thingy. I said, okay, I'll get the PulStar. It worked so well.
That's
So
great.
again, when I think of the PulStar, the only word that comes to mind really is eloquent. It is a really eloquent design. It's simple, it's effective, it's reproducible and reliable. It is good to hold because it feels like quality products. It doesn't feel cheap, plastic, breakable. I mean, I've come close to dropping it a few times. Oh my gosh, I will throw myself under it to catch it, or drop my foot if I have to. I'll smash my foot with it before I let it hit the ground, because that PulSar is like gold for me now. And I have to say, I wish I had found it 28 years ago when I first started, because oh my gosh, 20 years of physical hard work wore me down, and I had my stroke. And that's what scared me the most. And I thought, this is it. But the PulStar has renewed my excitement for adjusting. I mean, I've never lost it. I want to work for another 30, 40 years. And the PulStar makes me see how I can do that regardless. It's just incredible. Patients that come in that are, I have patients that are 60s, 70s, 80s, even 90s. Some are coming in walkers, some are walking in fine, some have canes, but it's so easy to adjust them because I can sit them down and do them seated and do the PulStar. I prefer seated myself because they're weight bearing, the joints are loaded, they adjust more naturally. Standing up, if they close their eyes and put their head down, they get dizzy. So this way I can have them stable while I adjust. The ones that are in wheelchairs, I can adjust right down and around the wheelchair. It's wonderful. Some of the wheelchairs are so thin, I can just go right through the back of that soft fabric in the back, and it works beautifully. I don't even have to have them lean forward to get to their spine. So
Nice.
children as well. Kids usually get nervous with especially with manual adjustments. But I had a 4.5-year-old. She was kind of sitting there wondering what's going to happen. And I started doing the PulStar down her spine, and she felt a little buzz. And she was kind of laughing and giggling. And mom was like, "It's that tickle." And she was just laughing all the way down. I got to her low back, and, and she, oh, it's making me toot. And she thought it was making her fart. It was pretty funny. And then we did the adjustments on her, and she did very well. Like most kids, she kind of, what are we doing? Then it went in, and it was just go back and check it, and you can see the before and the after, and it shows that you got it cleared up and everything works. That's the best proof to me, because I don't have to talk, educate you and try and tell you what's going on. You can turn around and see it before I've even said anything. I'll do all the listings, do a post scan, and before I've even turned to look at the computer, the patient's going, "Oh, doc, there's 2 more you missed." I said, "Oh, okay, let me go back and get those 2." Oh, there we go. Okay. And now people are starting to feel it as we go. I'm adjusting with the PulStar in there. Oh, there it goes. I said, "You felt that?" "Oh yeah, I did." "Oh my God, that was nice." The feedback is incredible.
That's really cool.
I have over 2,000 patients. Only one of them, she prefers me to adjust her laying prone rather than sitting up. Not sure why, but she does. So I do it prone, and it works beautifully prone. I just prefer upright myself because it's my preference. But I like the freedom to choose sitting, standing, prone, doesn't really matter. And I have one other patient who she really preferred hands-on. She just didn't like machines, but that was it. Out of over 2,000 people, I mean, everybody's responded pretty darn well. Even the skeptical people that say, "I don't know, does this really work?" I said, "You don't have to believe it. Just sit down and let me do it. You'll see. It does work. I know it does. I've seen it." And whenever someone says, "It doesn't feel like it's going to do enough," I said, "Well, let me tell you." And so I tell them about a patient who came in, and I thought he had a herniated lumbar disc. He was walking in 45 degrees forward, sweating profusely. oh God, son of a, trying to walk on the furniture and holding on to things to move. I thought, oh boy, here we go. Come on over here, sit down for me. So I did the PulStar, and by the time I got done with his spine, I said, stand up, let's take a look. And he stood up straight, walked across the room. I went, oh my gosh. And I mean, his pain was gone. He wasn't sweating anymore, no more pain. I mean, it was incredible. But from the look of him, I thought this is going to be, it would have been darn near impossible to get him to lay down or lay flat and try and use a drop. That really wouldn't have worked too well. So my advice to all the new students that come out has always been get good equipment. You need good equipment. And the drop table, an adjusting table in general, is one of your biggest tools as a chiropractor. It's really important. And then there's the PulStar. I got to say, it's become my most prized tool, honestly. If I didn't have a table, I could still adjust people sitting up in a chair and get 90% of what I want to get with just the PulStar. I could do a few manual things on wrists or ankles or whatever I need, and I wouldn't even need a table, which is what's so amazing to me.
Wow.
Heaven forbid if something happened and I were in a wheelchair, I could still work in a wheelchair doing the PulStar and performing adjustments to people even in wheelchairs. So it's that versatile, which is what's wonderful. The quality is still there. With every patient, I still get results. And everyone seems to improve more and more with time, which is what's so incredible to me, that it lives up to everything you said it would. I remember when we got it, I came out to Philadelphia to meet you and everybody and learn how to use this and how this thing worked. And I asked you,
did you feel from that training that you got a little bit of something, that you were able to take home and be able to work with?
Yeah, okay. The training was invaluable because it was awkward trying to figure out, how do I hold this thing? What am I doing? I didn't think that way. I always thought palpate, feel, do what I got to do. And trying to do this I did it, but I was awkward. The training gave me a good sense of how to hold it, how to, okay, go, there we go. And it integrated everything seamlessly. So I looked more professional. So when I went back, my learning curve was just, I'm there. There was no up. Wow. It was just, okay, got it. And then,
nice.
And I forget every now and then, and I have Tammy, and she's my office manager. She was there with me for the training, and she does the PulStar on me when I'm dying. And she's going down, okay, counting, and that's when I remember, oh yeah, okay, she's not doing this every day, because I'm like, okay, there we go. And she's like, well, 7, 8, okay, got it.
Right.
But
you've got those landmarks and
okay,
have those in memory.
Once you get used to that, it's so much easier. But it's a better way of thinking about adjusting. It integrates what we learned in school from palpating and finding the locations and what to do, and the PulStar really cements it in any direction, which is just
right.
That much better.
Oh, that's awesome. Now you did discuss that there are some people that are a little, they come in and say, they're a little skeptical about it. You told me once about a golfer that stopped in once.
He was funny. He came in and looked at me, crossed his arms. I said, okay, yeah, I get it. You don't want to be here. What's up? Why are you here? Well, my wife made me come. I said, okay, what's going on? I got some pain here and there. And I said, well, why are you here then? He said, well, my wife is tired of hearing me complain and hurting, and I'm not doing anything about it. I said, okay. And she said, that's it. I'm done. Yeah, no more sex. If you don't go in there and get adjusted, no more sex. It's over. So that's what motivated him to come here.
That's quite a motivation.
I looked at him and said, this is not my doing. This was her. This was not my idea. I said, but what can I do to make you happy that you're here? He says, can you help my golf game? I said, well, yeah, of course I can. What's going on? And he's like, I don't know. My aim is off. I'm slicing or hooking. I'm having more trouble off to the right or off to the left, people who don't golf. Or it's not hitting it as far. I used to get it really good. Now I'm getting less. And I said, well, that's very simple. If your shoulders are out, if you're right-handed, your shoulders off, you're going to stop short because it hurts. And then you're going to slice that ball off to the right every time. If your low back's off, you're not going to follow through with the swing, and you stop short, and it's going to off to the left every time. And if you can't get that straight, your strength is gone. You're not going to get that power you want to get the ball as far as you want. So he sat down begrudgingly, okay, we'll see. And I did the PulStar. I said, you don't have to believe me. You'll see. Trust me. It really does work. We got done. I said, okay, see you next time. When he came back, he had the biggest smile on his face. I said, oh, let me guess. Your game improved, didn't it? He says, yeah. I said, what happened? He said, I'm hitting 350 yards now, straighter than ever, further than ever. Oh my, I said, I told you, it's not rocket science. It's very simple. I said, the PulStar is probably rocket science. How it works, I don't know, but it's incredible. And now he's converted. He comes in and lets me adjust him. He just wants his routine maintenance to keep him going so he can keep golfing.
Keep golfing.
Likewise, I have a patient who she's 60, I want to say 65, and she still wears huge high heels, like stiletto spike. I keep telling her, what are you doing? Your low back is killing you, your neck, these heels. Why are you wearing these heels? She looks at me and says, Doc, I come in so you can keep me going so I can wear those pretty heels. I said, okay, let's get you adjusted. It keeps her so she can wear her pretty shoes.
Her specific activities of daily living.
Yeah, that's her main thing. His was golf. So
That's
anyway,
very
the
cool.
PulStar helps in a lot of different applications. I can't think of anything that I haven't been able to use it for, really. I mean, every single patient, I'm using it. It doesn't matter how old they are, if they're 90, 94, if they're 3 or 4. Newborns, I don't use the PulStar on. Those are hands. But as they get a little older, they get a little bigger, then I can, when they get big enough to use the PulStar with them, then I use it for sure. It's safe enough to use on newborns. That's not a problem at all. I'm still, and I forgot to mention, I was doing upper cervical 28 years ago, only upper cervical, just Atlas and Axis. That's what I started out doing. Well, I had a scanner, I'd scan and it would show you a line graph and a bar graph. And okay, we do the before and after, similar to the PulStar, which I loved. Gave me a lot of credibility showing what's going on. And over the years, I've done a lot more full body work integrated with my upper cervical specific. But I have to say, I've started using my PulStar for upper cervical instead of going in by hand. And that blew me away. I did not think that was going to work because upper cervical specific, the way I was trained was hand, knee, chest, table, head turn like on a chopping block, and you're hitting that pretty hard forcefully. You're getting that to move. I didn't know if the PulStar would cut it. And I started using it on my upper cervical patients to do the upper cervical adjustment. And I did the thermal scan before and after, just the PulStar adjustment, and it went straight and clear. And I was like, wow, this is doing my upper cervical work for me as well, which just impressed the heck out of me, which is good now because the thermal camera, the thermal scanner, they have switched to a subscription service like you did. And you have to pay for the monthly, which when you first did that, I wasn't too happy about that, but I'll get there in a minute. The scanner, they changed it to subscription and they want all my data on the cloud. And I said, well, no, I don't want my data on the cloud. I don't want to have people having access to my patient's information. And I don't want to have to rely on my Wi-Fi because it's spotty at best to be able to download my scan and continue my work with this amazing scanner. So push came to shove, they've gone subscription. The software is outdated now and doesn't, so I got rid of my scanner and I'm not doing the upper cervical scanner anymore. But I'm still adjusting upper cervically just with my PulStar. And when you first brought it up that we were going to go to subscription, I fought you tooth and nail. I didn't like that idea one bit. First, it was, oh, more money, really? I don't know, gosh. But then I saw the benefits, and now I really, really appreciate it because being a Mac, the Mac's update, and I got to say one more little side note. I love the fact that you chose a Mac and not PC. I had PCs forever. I switched to Mac, long story there, but I'm on Mac now and I love it. And I'm glad that you used Mac because they demand the top-notch operation. They want the full download of software, not a 32-bit version. They want a 64-bit version without getting technical. It just works better. So my Mac always updates and updates. And when I get the new operating system, sometimes the old PulStar software, you hadn't updated it yet, and I didn't know, don't update yet. And so I would update, and I'd call you and OG, so okay, we get it done, boom, there we go, okay, it's fixed. But every time I updated, I wondered, should I update or should I wait? I love it now because with the subscription service, you made it an app, and I don't have to think about it. The app updates automatically. So when my OS updates, or if any little security thing updates, my PulStar will say, oh, update. There you go, automatically in and done, and it keeps on working beautifully. My only gripe was with Apple, not with you. I've gotten used to the voice, and I like Victoria's voice because her voice is good. I think Deborah's popped up one time, and her voice when she says lumbar, she says lumber, and I'm like, what? No, we're not chopping down trees. It's lumbar. I didn't like her accent, so I like Victoria's voice, and thank God you found it, we can download it and get it back. But Apple took it off. And I was like, no, no, Victoria Secret is what I've been used to for years. So I got that back, which is good. But I love the app because it's quicker, it's faster. It opens up instantly. It's ready to go in a second. I mean, it's just, it updates, it runs, it's automatic, it's wonderful. If I drop my computer, or if heaven forbid, I live in fire country apparently now. 2017, there was a huge fire that burned about 25–30% of Santa Rosa, where I'm from.
Wow.
In 2019, there was another huge fire that burned a lot of the cities up. So my point is, if my place burned down and I lost my laptop, or I lost my equipment, I know I could call you, get another PulStar, get another laptop, download the app, boom, be up and running in 10 minutes and be ready to go, because it's so quick and easy. I don't have to rely on the internet to be able to do my scans like the thermal ones did. My data is still safe because it's still on my computer. I still hold it all, which I love, because you let me control it all. You just,
if you want to put it in the cloud, you can, but that's entirely up to you.
Exactly. Yeah. And so I love it, because I don't have to worry about my backups are safe and everything. It's just thoughtless. I don't have to think about protecting the PulStar. It's just there, and if I need it, I got it. And that's the other thing. I know I've said this over and over again, and if anybody's watching, you should know that anytime I've even had a question, I can call and get Christian in a heartbeat. You're always friendly and happy. You're always there with an answer. And if you don't know, you look up and get back to me like within seconds, and we fix it, and boom, we're up and running again. And most of the time, it's my problem, because I don't know quite what I'm doing. But although this time the microphone problem wasn't all my fault.
That was not your fault.
Anyway, so the PulStar, yeah, it has changed my life immensely. And like I said, I wish we had had it. I wish I had known about it 20 years ago. Apparently it was there. I just didn't know. When I asked that doctor who was 80, turning 81, I said, how long have you been doing this? He said, 41 years. I said, wow, okay, I've been doing this 20. Holy moly, you got double on me. I said, how long have you been using the PulStar? He says, 41 years. And I said, really? Wait, this has been around for 41 years? He said, yes, it didn't have the beautiful screen with all the colors like it does right now, but it had a really great system, and you could adjust, it still worked the same. And that's when I was impressed, because of the longevity. And like I said, the quality has maintained. You haven't gone down in 40 years. And I've only had it for 8 myself, but I have fallen in love with this thing. And one time when my computer glitched on me and I couldn't get it up, first I almost had a heart attack. I'm like, oh God, wait, I don't have my PulSar. What am I going to do? And my patient showed up, and I said, okay, come on in. Let's get you on the table. And he, well, wait a minute, aren't we going to use the little click thing? I said, I'm sorry, my computer's down right now. I'm working on it. And of course, when he was done, I had a break. I called you. You had it fixed in 2 minutes, and I was up and running for the day. But I noticed at that point how much I rely on the PulStar and how important it is to me, because it's just become my most important tool. I mean, even I can't believe I'm saying this, even more than my adjusting table, which I mean, a table, that's the chiropractor's tool. It's like a cardiologist or a podiatrist. We all have our tools, and the PulStar has taken my #1 position.
That's fantastic to hear. Every time I talk to you, we have these great stories that you tell me about different patients and everything, and how the PulStar has been helping you and your practice and your patients, of course, which is the most important thing. But I just wanted to chat with you again, because it's so much fun, and be able to capture it and have it for posterity, which is
absolutely, yeah,
so cool. But and I appreciate that you've worked with us. It was your idea to come up with the button change to be able to move from osseous to point, and then also to myofascial without having to go to the computer. And so, it's been great to be able to work with our doctors like yourself to get feedback and say, hey, what can we do to make it better?
That's what I love, because you listen, and if you can improve it, you do. And I was having trouble. If I was over here, I couldn't go over to reach to switch modes from osseous to myofascial to point. You can go to point, you can double click it, but when you switch that to double click through the different modes, that just made it so much fast. It sounds ridiculous to say faster, because it only takes me 5 minutes to do a scan, adjust people, post scan, and I'm like, there we are. And honestly, my visits are 20 minutes, so I'm like, okay, I've got time to talk, because I'm getting all the work done. So now I double check and triple check, and let's see what's going on with your wrist, or how's that finger, what's going on with that toe, and I can use PulStar to do it. And that's the best thing to me. I still want to try and work out a way to scan ribs in the original software. That's
Yep.
one thing.
Well,
But I know
I
you're
and
working.
I think and I think maybe, hearing you talk a little bit more about the upper cervical, maybe we can come up with some analysis there to help you. If you don't have the thermal readings, maybe we can show that it's cleared out, with a pre and post analysis of some sort too.
That's what I've been doing. No, I've been using the
Okay.
PulStar.
Oh,
I haven't
great,
checked
for
in
the
3D,
analysis too.
and it'll show me a big red bar right there, C1, and I'm like, yep.
Okay.
And then I know from the X-ray, the upper cervical specific, I know which one what I want to do with it. So I'll go directly to the side, not just the back. I'll go to the
Okay.
side, turn their head, set them up like I was going to do it by hand, but I use the PulStar instead for the force. And then when I'm done, I go back and recheck, and it clears right
It's
out.
cleared
So
out.
no, it's
Oh,
taken the
that's
piece and
fantastic. So
turned
you
it.
don't even need something specific
Yeah,
for up there. That's amazing.
it's already done that for me, which is amazing. That's what I'm
Very
saying.
cool.
It's replaced my what I want to say, my whoopee, my teddy bear that I held onto forever was my thermal scanner. That was my upper cervical. This gave me validity, and look at this. The PulStar surpassed and taken it. And now that they're making me put data online, I'm done with the thermal scanner and I'm just using the PulStar because it's so impressive.
Yeah. Outstanding. Well, thanks again for taking the time today. I know, your time is precious. We want to keep you working with your patients as long as we can, but just a few minutes to talk to me is fantastic, and always makes me feel better about what we're doing out in the field as
Well,
well.
always wonderful talking to you. You guys are always so friendly and happy and always so helpful, and everything you keep improving, just improving.
Ah,
It's amazing to me.
great. Well, you can thank my dad for that.
Yeah, absolutely. Absolutely.
Well, you have a great day then.
You too, Christian. Take care. Bye bye.
Thanks.